Why is dentistry so expensive? You know, when people think about dentists and going to have dental treatment done, you know, people talk about it being expensive and that being a main reason why people won't go to see their dentist. So why is dentistry so expensive? Hi, my name is Dr. Arnold and I'm a dentist based in Lancashire. And in this video, I just want to talk about, some of the reasons why the cost to have dental work done can seem to be like a big investment when you have treatment carried out. Now, the first thing to think about is the fact that with dentistry, we're talking about having trained professionals that are going to be making sure that you have treatment that works for your mouth and that's going to last you a long time. You want things to be hygienic, so you got to think about these instruments being cleaned and being disinfected in a regulated way. That takes a lot of different steps before the instruments reach your mouth. You've got to think about the staff who are trained to work in such a way that they're preventing cross-contamination of instruments and different sections of the building. So, the whole process of keeping you safe takes quite a bit of training and takes a lot of different resources to make sure that's happening properly. We now need to think about the staff members who are involved in, your dental visits, from the receptionist to the nurse, to the dentist or the hygienist, the therapist that you might see in a dental practice. You've got to think about the materials that are being used. These materials are regulated, and we're making sure that we're using materials that are biocompatible, they work in your mouth. And the way we apply these materials to your teeth is also very specific. There's lots of different steps to making sure that the materials stick well to your teeth. Maybe for fillings, there's a certain way of making sure that the fillings stick well to your teeth, making sure that the area is dry, making sure that we put a gluing agent onto the teeth and we're using that light to then set the filling material. If we're making you a crown or a bridge, we've got to work with a technician who's got to be able to fabricate a bespoke made dental device, whether it's a crown or a bridge or a denture, that works for your mouth, that works for your bite, that's sized appropriately for your mouth. So there are a lot of different expertise that are going into making the dental devices or the materials that are used in your treatment. So you can start to see how all of these different things add up. What I say to my patients is that when you maintain your oral health, it reduces or prevents you from having invasive dental treatment. And it's when you have invasive dental treatment, that's when the costs start to significantly rise when you go for dental visits. So if you can be seeing your dentist regularly for your normal checkups, your normal hygiene appointments, and if you're maintaining your oral health well at home, then you shouldn't really have to have the more costly procedures, which can seem intimidating. So what I'd say is the best way to keep your dental costs very low is to make sure that you're seeing your dentist regularly. If you find yourself in a position where you're having to have quite a bit of dental work carried out, what I'd say is have a chat with your dentist, with the practice, to see if the costs can be spread, if maybe the treatment can be phased so that you don't have to pay for everything all at once. You do the urgent things first, and then the other treatments, you do them at a later date. Or maybe there's a payment plan option available where you can spread the costs. So always have a conversation with the dental practice just to see if there are other ways that will make the treatment affordable for you.